Dr. Pauline, working as land animal health consultant in the ASAL Extension Limited for East Africa, Kenya. She has an immense experience in zoonotic disease mitigation through laboratory diagnostic capacity building, Dryland livestock production system, especially in response to disease transmission, and use of participatory epidemiology techniques to document ethno-veterinary livestock diseases, identification, their control strategies in the dryland. She's basically a veterinary surgeon. So I would like to invite Dr. Pauline for the next talk.
So as I said before, my name is Pauline Gitonga, a veterinary practitioner in the drylands of Kenya. My presentation today is on camelid diseases and health management, a practitioner's perspective. I want to pass my gratitude to the organizing committee for bringing on board a diverse audience. So this is not an original research, this is just a practitioner's perspective of how camel diseases are changing with regard to the climate change context. So with regard to the outline of my presentation, I will give a brief background because this has been done by presenters before me. I'll give a brief background of the camel population and distribution, how you link livestock diseases and climate change. I'll highlight the OIE efforts to classify important camel diseases globally, and also give you just a list, a one-slide list of what are the common diseases that are in literature, both grey literature and scientific literature. And then, of course, what is the practitioner's way forward? What would we like to see the scientists do to help us manage the camel diseases? So as a starting point, I would like to say that, of course, everybody has mentioned that the current camel population is estimated to be 35.9 million with an annual growth rate of 3%. And this data is mainly from 46 countries globally, and 20 in Africa, 25 in Asia, and 1 in Europe. The global data does not make a distinction between the two species of camels, that's the one-humped dromedary camel or the double-humped Bactrian camel. It also does not take into consideration the wild camel, the Camelus bacteriospherus, that is found in China and Mongolia deserts. And this population is estimated to be close to 1,000 to 1,600 animals. And it also does not take into consideration the South American camelids, the small camelids that are estimated to be close to 10.9 million animals. So as said previously, of course, we've said the 80% of dromedaries are found in African continent, specifically the Horn of Africa, North Africa, and Sahel region, with Chad and Somalia having the highest population of over 7 million animals. So with regard to the Bactrian camel, they are found in Eastern Europe and Central Asia. And we do have what we call the camel hybrid breed, that is between the dromedary and Bactrian. And there's a very good paper that describes this hybrid, and this is by Maurizio Diolio, and he describes it from Kazakhstan. So of course, we all know, is it the famous or the infamous wild dromedary population that is estimated to be about 300,000 animals. So that's a distribution of the Southern American camelids. Of course, we do have two breeds, guanaco and vicuna, which are the wild species, and llama and alpaca, which are the domesticated species. So there is a paper by Villa and Azamedia, 2020, done last year, that gives a very good description of these species with regard to even their origin. So I said before, and as indicated by peers, is that yes, climate change is here, and it's mainly due to, of course, we call natural events, but also anthropogenic, that is human events. And it's linked to greenhouse gas emissions, with livestock told to contribute 14.5% of greenhouse emissions. And of course, the cattle are the most incriminated. But the question here and to this group is, what is the role of camels? Are they greenhouse gas emitters, or are they mitigators? So researchers from Morning have indicated that, actually the camel is a livestock species that should be used to adapt to climate change and mitigate climate change. And this is mainly because it thrives on poor quality feed. It can tolerate extreme temperatures. It can tolerate diseases somewhat, can tolerate drought, can walk for long distances for food and water, and can produce meat and milk even under stressful conditions. So what does OIE say about camelid diseases? So the OIE, the Biological Standard Commission, established in 2008, an international ad hoc group on camelid diseases. Now, the mandate of this group was to generate a list of infectious diseases of interest in camels globally, and they did so in May 2010. And they prioritized the diseases into 3 groups. We have group 1, these are diseases known to produce significant clinical disease in camels. And group 2, they are not reported to cause disease in camelids, but are potential pathogen carriers. And group 3, these are minor diseases. So that's an infographic of the viruses and bacterial and parasitic diseases that the OIE has identified as important. So these are tables, and I'll quickly move through them because of the time. We have group 1 and group 1 viral diseases. You can see dromedary and Bactrian have almost similar diseases, with only the difference here being the foot and mouth disease that is mainly found to be in Bactrian. And in fact, in this group, the ad hoc group from OIE, they removed FMD as a disease of dromedary and left it as Bactrian. Then with regard to the South American camels, you can see bovine viral diarrhea, blue tongue, and herpes virus are important viral diseases. With bacterial diseases, the list is similar, longer: anthrax, brucella, clostridial. All the pathogens that most of you are aware of are in this, classified as group 1 bacterial diseases. So what does the literature say about diseases? We say that most literature identifies parasitic diseases and digestive diseases as important. And that's a list of diseases: trips, mange, camelpox, contagious eczema are high on the list, top 5, with things like camel sudden death syndrome and acute respiratory disease syndrome coming in at the bottom, and mainly because they are unknown, and we'll discuss that later. Zoonotic diseases are also important to us, and but we have these diseases that have very little clinical syndromes in camels, but are important in humans. These are brucellosis, MERS-CoV, and Q fever. So allow me for this presentation to concentrate on diseases that have a more direct link to climate change. So the first one I've selected is Cacheus lymphangiditis, or CLA, or pseudotuberculosis. And this is a picture of a dromedary with your characteristic enlarged external lymph nodes, in this case, bilateral inferior cervical lymph nodes. So it's a contagious disease caused by intracellular bacterium that forms abscesses in both external and internal lymph nodes. The abscesses enlarge and may rupture and discharge infectious pus, and can also cause mastitis. The causative agent is a gram-positive pleomorphic rod called Corynebacterium pseudotuberculosis, serotype ovis, mostly isolated from literature, according to literature. So it forms palisade arrangement of cells in short chains, V or Y, or in clumps resembling Chinese letters. Other bacteria can be involved, so you might not isolate a pure culture of Corynebacteria. You could find Streptococcus, Staphylococcus, Actinomyces, E. coli, or other Corynebacteria species. And that is the bacteria under the microscope after gram staining. So what's the epidemiology? Of course, through the transmission is ingestion, inhalation, or entry through broken skin or mucous membranes. We have predisposing factors, which are heavy tick infestation, animals that have mange or nodular worms, and disease in sheep and goats. So most herds that are grazed together with sheep and goats, they have high incidences of CLA. They say, unlike the small ruminants, the incubation period in the camel, it has a long incubation period of 6 months to 1 year. What we don't know, is it coming from the carriers, or is it because there is environmental contamination? So morbidity rate is high at 90%. The rate is low. And according to literature, the old wild camels, the dromedary and Bactrian, we have a mortality of 15 to 28%. But the South American breeds, we have a mortality of 22%. So literature says that the most common form is the generalized cutaneous form, and mortality is more common with the form that has internal organ involvement. Distribution is worldwide, but there are rare reports in North America. Clinical signs, I said before, there's formation of a painless lemon or orange-sized abscess in the external lymph nodes. And the common lymph node sites are the cephalic, prescapular, and prefemoral lymph nodes. In camels, when you excise the lymph node, there is no laminated onion ring pattern that is seen in goats. So if abscess occurs internally and it breaks inside the chest cavity, they can produce bronchopneumonia with pulmonary caverns. On PM, there is of the disease that causes internal disease. You can have lung, bronchial, and mediastinal lymph nodes involved as the most affected visceral sites. So these are cut surfaces of during PM. So the first picture is the incised mandibular lymph node with a greenish cheesy pus. And the second is incised inferior cervical lymph node showing enlargement and congestion. So this disease should be differentiated from tuberculosis, which is an important zoonotic. So CLA, though rare, can cause zoonosis. And there are reports of zoonosis in 10 human cases in Australia in 1997, where farm and abattoir workers who are handling sheep and goat who had CLA, getting chronic lymphomegaly that required surgical treatment. So diagnosis was, of course, from clinical signs, confirmatory through when you lance abscess and collect sterile swabs for culture and isolation. You can culture on agar at 37 degrees centigrade for 48 hours. And you can identify through biochemical test and morphology of the culture. So we have an ELISA. It is not validated in camelids, but they say hemagglutination and hemagglutination inhibition ELISAs can work. But the most effective ELISA has been seen, the one that is able to detect antibodies against the PLD exotoxin from the bacteria. And this is actually what Europe used in South America and the farms that farm llamas and alpacas. So they inspect, palpate, and do serology to be able to decide which animals they'll cull and keep. So treatment is cull infected animals. Of course, this can work for Europe, but it's not practical in our setup. So what our herders do is that they move. So we have what we call a kraal or boma. So they move the kraal or boma or isolate the animal. But this is impractical because sometimes most of the animals in the herd have the disease. So you can also lance a ripe abscess using strict aseptic method and clean daily with diluted iodine-based products. The bacteria is sensitive to antibiotics, penicillin, tetracyclines, and cephalosporins. However, the pus and fibrin sometimes inhibits efficacy of the drugs. So there's a paper that talks of combining penicillin and erythromycin through the intramuscular route, and it has proven to be effective because of the erythromycin ability to penetrate the capsules. Also, another paper talks about in adults, you can give a 20 ml dimethyl sulfoxide, DMSO, and 20 ml enrofloxacin for 12 days. This is an extra label use, meaning it's not indicated for use in camelids, which is in most cases, most drugs that we use. And I don't know practicality of 20 days in our setup, but they say it actually helps. So vaccination has varied results. There are those ones who have formed autogenous vaccines using the bacterial cell wall and toxin. In the new camels, the llamas and alpacas, a commercial vaccine has been used, but it causes granulomas at the injection site, so it is not very popular. So there's a research gap definitely on vaccine development for this disease. So the second disease is mange, which is common. Everybody can identify those syndromes. So it's an extremely contagious skin disease characterized by scab formation, pruritus, dermatitis, thickening, and hyperkeratosis of skin and hair loss. It's common in all species of camelids. It's a hard problem and has a long-term morbidity, and it makes the animals that are affected susceptible to other infections like contagious skin necrosis, abscesses, and contagious eczema. So as you can see from this picture, you have the red arrows shows alopecia, encrusted plaques, and hyperkeratosis of the skin. This is from the book Camel Digital Necrosis by Dioli Maurizio and others. So this is caused by a parasitic mite, Sarcoptes KB variant cameli. And in addition, in the South American camelids, there's Sauroptes and Coreoptic species that are important. So it's reported all over the world. and mainly occurs in all seasons, but is most common in the cold season. And in this case, the South American camelids, because of their long hair, are more susceptible, because by the time the owner discovers that the animals are having the infection, it can take quite some time. So transmission is, of course, through direct contact or indirectly through inanimate objects, saddle, harnessing materials, beddings, and tree trunks. And it causes very severe pruritus. So the animal spends the time scratching on trees and rolling on the ground. And if any other animal comes and scratches on the same tree or goes to the same sandbar, they will get the infection. So prevalence varies, and it, of course, depends on predisposing factors of the nutrition of the animal, concurrent infections. So we can have a morbidity rate of 20 to 90%. Mortality is not quite clear, but it says less than 10%. Low in adults, but high in cows. I've talked about the predisposing factors, and also this disease is a zoonotic disease, common in handlers and caretakers and riders. And the syndrome in humans is called pseudoscabies, and is a self-limiting disease if the immunity is good. But if the immunity is not is compromised, then you'd have issues where it can extend and cause severe disease in man. So that's a skin scraping of male and female succumbing mange under 10 microscope. So the clinical signs I said before, but they are more common in the face, neck region, abdominal region, inner surface of the thigh, and inguinal region. Diagnosis, of course, is skin scraping, and you just don't scrape and observe under the microscope. Sometimes they say if the disease in the early stages, you might not see the mites, but in the later stages, if you do a skin scraping, you dilute the scraping and digest the scraping with the 10% potassium hydroxide. You can heat it and leave the sample in the heated solution for 3 hours for better examination of the parasite, the mites. So that's mange. Also in the alpaca. So treatment is treated effectively with acaricides like organochlorine, organophosphates. It's prudent to cut the haircut, clip or shave it, then apply the acaricide through spraying, and it's supposed to be forceful spraying. In areas where the spray is not able to reach, you can, if you can use, actually we use cloths to rub the skin. There are also people who advocate for scrubbing the fur coat to remove the scabs and hyperkeratosis materials, so that the acaricide can enter in through the skin well. So very good success with macrocytic lactones, that's ivermectin, doramectin, and epironectin. An injection given, 2 injections given 2 weeks apart subcutaneously, plus acaricide have resulted in clinical resolution. There's a word here that South American camels affected by choreoptic mange respond better to epironectin. So prevention, of course, is do not introduce herds or animals that have it, and prompt treatment of animals that have it, because it can spread throughout the herd. So there's also another disease called mange. That's a common name, and it's not a misspelling of mange, that has been reported in llamas and alpacas. And it looks like mange, but it appears as crusty pustular dermatitis, generally around the mouth. The cause is not known, and so research is still out there on the cause of this. So other cutaneous diseases are, of course, the camel nasal boat, Cephalopina tillata, the ostrich fly. Of course, we have the contagious eczema, camel off, and camel off is also a zoonotic disease. So you'll allow me to go a little faster because I'm looking at the time. Other contagious diseases that will be important to us are contagious skin necrosis, where no study has isolated one single bacteria, but Staph aureus is the most common isolated. It occurs in multiple circular necrotic areas of skin with multiple abscesses in brisket and chest area, but this can occur in any part of the body. It's responsive to treatment, according to literature, and amoxicillin and clavanulic acid produces better results and faster results when you compare to penicillin and streptomycin. Another disease is dermatophilosis or rain scald, and this is very common in the South American camelids because of their long hair and during wet conditions. The treatment is responsible to penicillin and streptomycin and oxytetracycline. A paper talked of giving IV to injections to get good clinical resolution. Of course, you shear or clip along the hair, and since it produces almost lesions on the skin, you can apply topical iodine-based products to heal the lesions. It's also a zoonotic disease in man. It causes vesicles and pustules on hands and forearms, and serous exudates later on that produce pus. It resolves spontaneously after 2 weeks. So Camelpox, everybody can identify this as Camelpox. This is the only OIE listed reportable disease. It only occurs in the dromedary and Bactrian. It has been induced experimentally in New World camels, the South American breeds, but they don't actually get it naturally. It's caused by an orthopox virus, camel strain. So the strains can either cause local infection or generalized infection. Studies have said that it causes lifelong immunity. So it is common in where the dromedary and Bactrians are reared, except in Australia. I can be corrected if I'm mistaken. So transmission, abrasion, and mechanical by biting of arthropods. Hyaloma ticks is an important mechanical agent, common in the wet season. The pox lesion can occur anywhere, face, neck, under the tail, the whole body. It is accompanied by fever and lymph node enlargement, and in some cases can cause abortion. There's a vaccine called the Ducapox vaccine. If it's given at 12 months or 1 year age, the literature says the animal can be protected for 6 years. So another disease that can be confused with camelpox is camel papillomatosis. This is warts, and these are small cauliflower-like lesions that occur on the lips without involvement and edema of the regional lymph nodes or head, and it's common in young animals, and it is self-limiting. Camelpox is also a zoonotic disease, and reports have been reported in man in India and Sudan. So foot and mouth disease that is mainly occurs in Bactrian camels, vesicular and ulcerative disease of the mouth and feet of Bactrian camels. There was a serious outbreak in Mongolia in 2010. And the clinical signs were had fever, hypersalivation, the mouth had vesicles, and there were severe foot lesions and recumbency. And the most common thing about FMD in Bactrian camels is the detachment of soles of the feet. So they controlled it through giving ruminant FMD vaccine. They seroconverted, but there was no study or research on challenge. So once a seroconvert, if they are challenged, are they actually protected? So this is still a research gap that needs to be addressed. The other thing is a bovine viral diarrhea. We say this is common in the South American camelid breeds. It causes severe disease in alpacas and llamas that includes diarrhea, abortion, wastage, and death, has no current known zoonotic potential. It's an RNA virus, has 2 biotypes. Happens common in North America and Europe. Switzerland and Germany mostly have reported cases. It has a low morbidity and mortality rate. The dromedary and Bactrian have neutralizing antibodies, but not clinical disease. So in Egypt, they suspect in dromedary, it is the cause of intrauterine death, stillbirth, and Wilkes syndrome, and congenital deformities. And this should be investigated. There's a vaccine that can be given as 3 doses, but in most cases in Europe.
Dr.
Yes,
Pauline, please.
I'm also, yes. All right, so yeah, yeah, so I'm almost done. So
I should remind you about the time.
Yes.
Time.
Yes, I have 3 more slides. So another important disease is blue tongue. Does not cause disease, but it's important in alpacas and llamas. And West Nile virus, which is an important virus in humans that actually came from Uganda, which is our neighbor. And this, as much as we don't have a lot of information here, there is need for research on West Nile virus. So the other is, we all know PPR, with very little outbreaks reported, only 3. But the role of the dromedary in circulating this disease, because we are trying to eradicate PPR in small ruminants, should also be investigated. So Rift Valley fever is a common disease. We're all aware of that this will increase. And in fact, this year in Kenya, we had an outbreak caused by flooding of the Wasonyiro River. And with regard to the epidemiology of Rift Valley fever, this still needs to be investigated because of the ecosystem change. In our case, the upstream deforestation of the Aberdare ranges causes flooding of Wasonyiro River. And even when it's dry, you have RVF outbreaks in animals. So this was an outbreak of Mauritania, which was also almost similar to what we experienced in Kenya. So pneumonia in camels is important. We call something called the pleural curtain that supposedly can help prevent pneumonias in camels. This is more research is needed here. But pneumonia is more of a predisposing factor. There are predisposing factors for camels to get it. And isolated things are like viral, very many viruses have been involved, including bacteria. Treatment, they say if you do early treatment, and we have seen before the animal starts having compromised respiratory signs, if you treat, they will recover. Role of corticosteroids is varied in different practitioners. In very severe cases, they give with good outcomes. This is a case of what we call acute respiratory disease in Samburu in Kenya. And this currently is even going on, and we keep on getting this disease around this time with the postmortem lesions of arthesians and serious pus. So with regard to digestive system, we have the Mycobacterium Jones disease that is important. And it's important to us because this disease is similar to Crohn's disease in humans. And actually in humans, they've been able to isolate the MAP bacteria in patients that have Crohn's disease. So it is a disease that is watched for zoonotic implication. So it causes mainly intractable diarrheas in mainly the camels, the Bactrian camels, mostly affected, more than dromedary, and also the South American breeds. Okay, so those are postmortem findings in camels. And what is the take-home message for here? What is the conclusion? So we only have Camelpox listed as a notifiable disease. And we need to lobby for OIE to list other diseases. So what happens with Camelpox here, as much as they have listed it, they have not given it a code, so there is no trade implication or guidance on trade. Research needs to move from country-based studies to more extensive geographical studies. So there is need for collaborative research. It would be impressive to see research that cuts across Pakistan, Middle East, and Africa, especially Eastern Africa. More research on product development, because most of the vaccines and drugs we use are extra label. And also development of rapid kits, and especially so for pneumonia cases, because we really struggle to figure out what is happening with the pneumonias in camels. So there's need for more extension messages to improve camel husbandry knowledge. I am impressed by a book done by Impala Ranch that gives very good guidelines on how to manage camels. So research should also focus on arthropod and vector-borne diseases such as babesia, theileriosis, and Rift Valley fever. Those are my references, and that is the end. Thank you. I'm open for any questions. Yeah.